today we are in for a treat because we have Dr. Valerie Phelps from IAOM who's going to be talking to us about using the SI-Lock support belt for low back pain. We're going to run through some of the most common questions we get, hopefully provide you and your patients with a lot of great information. So Dr. Val, thanks so much for joining us. We're going to jump right into the first most common question that we get, which is, how do people know if they need an SI belt? And that also is, who is it for?
Well, thank you. It's great to be here, Derek. If a patient complains of pain in what we call the upper inner quadrant of the buttock, that is a perfect indication for an SI lock. Another place is what we call lumbosacral junction. If somebody has pain right in the dimples of the low back, that is an indication for a need for an SI lock. And then lastly, we find it very effective with people who have ongoing chronic conditions with what we call the gluteal muscles or the external rotators of the hip. So to help a tendonitis in this area, an SI lock can actually help unload those structures while they heal. So those are where the pain might be. Conditions that are often, diagnosed are sacroiliac problems, L5-S1 disc or facet joint problems, hip joint problems or tendon problems, or even pubic symphysis pathology.
Perfect. Okay. Well, yeah. So if an individual who's suffering from one or more of those symptoms uses an SI-Lock support belt, what are the benefits?
Well, the benefits are that it actually provides external support. So the pelvic rings, you have to see the pelvic ring as the foundation for movement for the spine and the trunk above, but also respect all the impact and load that it takes with every step, and even with sitting, basically all forces from below. So this structure is meant to be very, very stable and allow a little bit of movement, interestingly enough, so that we don't get stress fractures. So we've got this very tight SI joint. We've got a pubic symphysis in the front, and this external support allows for a more solid foundation, both for the spine, and then it allows for better absorption of the forces coming from below. So it'll also, by virtue of ligaments that run from the ilium to the L5 vertebra, it will also immediately stabilize L5-S1. So if you have L5-S1 disc problems or facet problems, and you want to stop the shear forces through that segment, by stabilizing the ilia, L5-S1 will also be better supported. The belt is simple and it's very comfortable to wear. So it also works as a reminder. Everybody should be utilizing their deep core, activating their deep core, whether that's through the transverse abdominis or pelvic floor, and just having a little external friction can remind you, I've got to also get my internal stiffness activated. So we call that a reminder to dynamically stabilize.
Okay, great. Yeah, so I know, I'm sure people would love to see a demonstration of how it's used, so we can dive into that next here. And also maybe as we're talking through that, there's a lot of similar tools available out on the market. So maybe as you're demonstrating for us on how to use the SI-Lock support belt, you can also talk to maybe some of its unique features and why it might be more superior to some of the other options.
Sure. What I love about the SI belt is that it's so simple. And I think that sometimes simple is just as good, if not better, than most anything. And when I've worn the SI belt, what I'm pleased about is that nobody can tell I've got anything on. So it's made to go have contact with the skin. There's a hypoallergenic non-stick material that goes on either side, and it's very, very low profile. It's also relatively inexpensive. So it's easy to have 2 or 3 lying around. I've had patients that have one for swimming, one for running, and one for day-to-day use And then, even one that's being washed while the other one's being worn. So low profile. And what's super effective about it actually is that it is a most effective stabilizer because it gives support from the sides. If you look at the pelvic ring and what we're trying to stabilize, the sacrum is this wedge shape, and the ilia come in and attach to it. So imagine, how can you best stabilize a wedge? Well, simply put a little ring or slip a ring around the narrowest part, and then with very little force, you've stabilized that wedge, which is the intent of this belt. Early SI belts, and even some still, have some sort of like big pocket pushing here. And that is not where the stability is needed. The stability is needed with force from the sides pushing in. So if you look at the belt, we start with the label in the back, and the label in the back can be applied either upright or upside down. What we're going to do is we're going to look for the sacrum on ourselves, and we're going to place that label in the middle of the sacrum. And then we're going to wrap those straps around to the front, and we're going to be looking to place them just above the top of what's called the greater trochanter of the hip. So here I'm going to show you on myself. I'm going to stand up on a little box here so that you can see me. All right, good. Okay, so I'm actually at about the same height as the skeleton. Here we go. Looking for the label. I'm going to place it right at my sacrum, which is kind of above the gluteal area there. And what I'm going to do is I'm going to make sure that the lowest edge of the belt is just above that very tip of my greater trochanter, and I can palpate on that on myself by sliding up my leg bone and then making what we call an internal external rotation of the hip, and the very tip of that bone slides under my fingers. Then I know I've got it just at the right spot. So what I'm going to do then is I'm going to take one end and I'm going to thread it through the plastic little belt, and I'm going to place that belt right at about the lowest part of my hip. It's not the lowest part of my hip, it's about mid-hip, but it's deep enough so that it is just right and does not interfere with sitting and bending. So then what I'm going to do is I'm going to relatively tighten the other side. And for this reason, we always have a short side and a long side. Once I get it perfectly placed just above the trochanters, label in my sacral region, then what I can do is I can take both and just tighten gently. Again, making sure I'm kind of in the deepest part of my groin there. Should be about 2 or 3 fingers room here, maybe about 15 to 20 pounds of pressure. That's all we need for a nice stabilization effect. And what we recommend is that you wear this actually next to the skin, there it won't slip. And each day, place this little plastic clip on an alternate side. So if I were to put this on tomorrow, I would simply undo it, turn it upside down, locate my greater trochanters, and now you see I'm going to have to switch this little clip to be a little bit more, again, deep in my groin area so that it doesn't interfere with sitting, and I'm ready to go the next day. So the things that I've said are pretty much well outlined in the little information sheet that comes in the SI-LOC packet. And what I wanted to make note of is that in the section that says applying the SI-LOC, it recommends putting the SI-LOC on while lying down with knees supported. And the reason it says that is because that places the sacroiliac joint in its resting position. That is one way to put the belt on, but you just saw me put it on in standing. So an individual can try standing equally on both legs, or sometimes it's more affected by actually loading the painful side. That's going to kind of lock in that side a little bit more. So you can be creative with how you are positioned when you put the belt on, and each position might give a little bit different effect. So try out different positions for your optimal placement.